Hello, everyone, and welcome to Inside Healthcare. I'm very excited. This is our 100th show, and we've got a great program for you. We begin with a daring rescue at a house fire in St. Paul. The St. Paul Fire Foundation just honored and recognized several of St. Paul firefighters for saving the life of one of their very own. I had the privilege to sit down with them recently to hear about those terrifying minutes when a routine fire turned almost deadly. Here, in their own words, is their story captured by award-winning videographer Joe Carlini.
For Engine 18, Engine 23, Engine 5, Ladder 22, Squad 2, and Chief 2. 1400 block of St. Albans Avenue North for gray smoke from the window of a dwelling.
Engine 18's on the scene. We've got a one-story wood frame dwelling. We've got flames and smoke showing on the outside. We've got smoke coming from the attic. Engine 18 will be pulling a pre-connect passing command.
We pulled up to the scene. There's smoke coming out of most of the windows, and there's flames on the outside because the fire had burned all the way through.
House was locked up, so we had to get in, and Ladder 22 forced entry into the front door. And then Jeff had the nozzle, so he went in first. Just kind of stayed at the door and pulled hose for him. And it didn't seem like that much longer, and then I could kind of hear the floor start to break apart, a crackle.
Tipped over, and then I realized there was a hole, and I was falling. So I let go of the hose line, and I don't know why, whatever. I spun, threw my arms out, and caught myself, and I had one leg above and both arms above, and my left leg was below the floor. So I was hanging there.
Man, we got a firefighter down. We got a hole in the floor. We got a firefighter in the basement. We got another guy coming. We got a firefighter down.
And then all of a sudden, flames were all around me. And I mean, next to my head, everywhere around me.
And then that's when I saw just a wall of flames come up, and Jeff was facing me. And then that's when I dove after Jeff.
Ian reached below me and opened up the bail, the nozzle, so water was flowing. And I was swinging that around with my hips and my left leg that was below the floor.
I knew we had to get the fire out, so I had to reach under Jeff because he had got the hose line lodged under his arm. So I had to reach under there, and I opened up the hose line so we could at least get the fire out.
It's pretty horrific. I mean, it really is. And, you know, engulfed in flames, and it's like, okay. You know, it's like, how long can I hang here? And because I thought the floor was gonna give way. And, but I knew first thing I was gonna do was gonna burn to death, unless we got the fire.
I was yelling for people to try and get to the front door. I wasn't sure who was at the front door or how many people were there because I couldn't really see through the door. So I was mainly yelling to get other people to come help.
And I could see ashes, you know, embers in the corner of the room and stuff. So I realized that the whole floor was pretty weak. And I thought the floor was going to give way.
All companies, firefighter down, firefighter down.
Mayday, mayday, mayday. We got a firefighter down at the front door. We're going to need a medic rig up at the front door.
And you think, well, this is somebody you live with day in and day out. This is the guy, you get under his skin, he gets under your skin, you joke, you cook. And at any moment, you know, all the guys think that they're going to go home at the end of their shift, but now something is, you know, happened to one of your guys.
I was holding onto a strap of his air pack. I don't know if that would have done anything, but just to make sure I wouldn't lose him. And then I just kind of stayed with him until everybody else kind of came.
And then Mike Mills came in.
Ladder 18, this is command. You guys can come to the front of the structure. We've got the firefighters down. He's still in the basement. We're going to need help getting him out.
We went to the front door to see what was going on, and lo and behold, seeing boots and seeing the struggle of trying to get Jeff out. Or black smoke, can't see, I couldn't even see my guys as soon as they stepped to 2-3 feet in the door. Couldn't see anything. He was tangled in wires. I think Engine 22 was in the basement, and they were trying to free him from the bottom. And his tank was actually wrapped up in some of the wires. And it's hard to describe how Jeff's SCBA was actually wedged into the floor. So when we were trying to pull him up, we were working against where his tank was stuck on the floor that he fell through.
I thought, okay, well, they'll get me out. We'll just see how long this takes. And then I realized that I might run out of air because I could not get to my air bottle. My arms were locked off to my sides and holding myself up. And so I was, if I ran out of air, it wasn't going to be good.
His toes pointed up, I knew it wasn't good, and so I just jumped in, and he was going down in the hole, and Ian kind of had a hold of him. I couldn't see who it was. I could just see the feet, and I grabbed onto the... It was pretty much black smoke, and then the flames came up around us. I think when probably a door or something got open, and fire got a little bit of air, and flames came up, and Ian was able to get the nozzle open and knock down quite a bit of it. And, our concern really was just getting Jeff out.
Lots of smoke. I couldn't even see into the front entryway. I wasn't sure who was behind me or what. I just saw a bunch of hands reaching in, so that made me feel better, knowing that there was somebody there.
We had tried to pull him out, just grabbing onto him, and that really wasn't working. He didn't really budge. And I remembered I had a Moorhead strap in my pocket, and I thought maybe if he was able to grab onto that or attach it to him, that would kind of give us a little more leverage in pulling him out, and ultimately that's what helped get him out.
I never saw anybody. I mean, I had a hold of Ian, or he had a hold of me, my arm, and I couldn't see him because of all the smoke. And so then somebody got in my face and said, here's a rope and a strap, grab on and don't let go. And I'm like, yeah, no kidding.
Not knowing exactly how he was trapped or if he was, alive or breathing or hurt, we were able to get him out of there.
Everybody else thought I was unconscious because I'd stopped talking to try and conserve my air in my bottle. He's unconscious. I said, no, I'm not. And I said, I'm okay, I'm okay.
After they got him out of the hole, he refused to get on the stretcher, and he's jogging to the medic rig on his own. And the only thing that I could do, although I wanted to go over, oh, you're okay, and yeah, good thing you're okay. Maintain your composure as a firefighter, but just give him a glass of water.
I guess it was only 4 minutes, but I was like, that was the longest 4 minutes. So it did seem like a long time.
Somebody asked me, could you feel yourself getting burned? I said, oh yeah, absolutely. Well, what'd you do about it? I said, nothing. That was the least of my concerns. Because, burn a leg is one thing, but, dying is another.
Once the smoke started to clear, you could actually see the hole, and think to myself, what was holding him up? There's really no reason why he didn't plummet down into the burning basement. But finding out what Ian had done, somehow getting around him and reaching through the flames to turn on the bail, and moving the nozzle around even though you couldn't see where the fire was, keeping him alive, and Mike Mills not letting him go. This kind of made me proud to be a part of the team.
Great guys, so I owe them plenty. So that was it's pretty good that they were there for me, and I would be there for them.
And dispatch, St. Albans Command. Again, most of the fire's knocked out. We've got some hot spots. All firefighters are accounted for.
And our congratulations to those incredible, amazing firefighters. They all received the 2013 John Natsoff Firefighter Foundation Award. So congratulations to all of them. Now we turn our attention to a new clinic for the first time in St. Paul's, helping victims of torture and war torture. To tell us all about it, we're pleased to have with us Dr. Jim Letts, the site medical director from Healthy Roselawn Clinic. And also joining us is Allie Beckman, the project manager and clinical supervisor with the Center for Victims of Torture. Thank you both for being with us. I know you have busy schedules, so we really appreciate that. So maybe both of you can kind of tell us, how did this all come about and why? And Dr. Letts, let's start with you.
So our clinic has, over the last several years, done a series of outreach projects for the Karen refugee community they're a pretty new refugee community, just resettling here in St. Paul over the last few years. And the typical story of the families that I work with is that years ago their village was attacked in Burma, and they had to flee through the jungle and make their way to the Thai-Burma border. And then they found their way into refugee camps there and have been there for 10 or even more years, and then just started resettling to the United States over the last few years. So as the number of patients that are refugees from Burma has grown over the last few years at our clinic, one of the big needs that we've identified is mental health needs that are unmet in our current healthcare system, just with difficulty navigating the health system with their language needs, and they're being brand new to our country. So there's a lot of traumatic experiences, as you can imagine, during that refugee experience for those families.
Oh, I can't imagine.
Yeah, it's pretty hard hearing those stories sometimes, and then it's really hard not being able to connect those patients with the services that they need, the mental health services that they need. So we identified that as a big need, and then started working with CVT, who we'd worked with in the past on some of our outreach work, because they're a known, established provider of culturally competent mental health care to refugee communities.
And you've been located in the Minneapolis by the university campus for a long time.
Yes, our clinic used to be exclusively there, going back to 1985. We've now moved our clinic to St. Paul, so our healing center is actually in St. Paul.
Okay. And what are some of the things that you help them with? And it's more than just the Korean population.
Yes. So our center in St. Paul it's one of our core services that we provide at the center. Our mission at CVT is to heal the wounds of torture and to end torture worldwide. So at the St. Paul site, we have seen folks from over 60 countries over the years, and we take an interdisciplinary approach. So that means we have psychotherapy, we have social work, we have medical services, psychiatry, massage, physical therapy, all on site. Because what we know about torture survivors is that it's not just a physical wound, but people can be impacted in all sorts of ways. So we try to have disciplines represented that can help people in all the different areas where they need help.
So why open basically a clinic within a clinic? Why are you doing that?
Great question. So CVT has long wanted to expand our services domestically, and we just have not had the capacity to do so. And so in one of our recent community projects, we did a focus group with refugee stakeholders, so refugees themselves, with refugee providers, healthcare providers, state policyholders, and exactly what Jim said, what we found is that the #1 unmet need for refugees is mental health services. And so Jim's clinic is one that has done amazing things in terms of adapting to the needs of the Karen refugees. Their staff represents the clients they serve. Dr. Letts sits on the board at the Karen local Karen organization. They have a patient advisory group that provides cultural consultation, et cetera. So this is a clinic where we know refugees feel safe and feel comfortable. And primary care is the first point of entry to the healthcare system for most refugees. So what we thought was by putting ourselves in this clinic where people already feel comfortable and safe, perhaps it will help with some of those barriers to accessing mental health. There's a lot of mental health providers across the Twin Cities, but refugees have all sorts of barriers like transportation, language, culturally competent care, and stigma, very frankly.
A lot of barriers.
Lots.
One of those alone could be a significant problem for anyone, but let alone all of them you take into consideration.
Yeah, our clinic has worked over the years to build some infrastructure to help patients overcome some of those barriers. And so I think as our patient number has grown, we serve now over 2,500 Karen refugees at our clinic. And as those numbers have grown and that trust has been established, we thought, why don't we bring mental health services here where the patients already come, they already can navigate the system within our clinic, and they feel like it's accessible. They feel like they can have some trust there. And when you're dealing with issues like post-traumatic stress disorder, depression, et cetera, that trust piece is really important. And I think that unfortunately there's been a divide in our health system generally across the country, where primary care and mental health providers don't work well together, and they don't communicate, they don't share information well. So a big piece of this project is to overcome that barrier that's built into our health system, and let
Wow, you don't even think about that.
right, let the primary care doctors and the mental health providers really be able to share information, because there's so much crossover between physical health and mental health.
And you touched on briefly, and you have too, just what are some of those challenges that the Korean population, what are some of the mental health issues that they do suffer from?
So most of my patients that are Korean refugees aren't victims of torture as the UN defines, politically motivated torture. Most of them are victims of war trauma, things that happened when they had to flee suddenly. And I have several patients that are amputees from stepping on landmines. I have a lot of patients, and in a project that we've been doing with CVT, where we've done mental health screening, we found that the incidence or the prevalence of post-traumatic stress disorder is very high in this population. So that's one. Depression, we think, is high. And then the usual sort of health needs that we all have, whether it's high blood pressure or diabetes or heart disease, etc. So in some ways it's like treating any other patient, but then this mental health piece with the high prevalence of trauma, it makes it different.
Yep.
And you're actually going to have your specialists on location right there at the
so what
clinic.
we're going to be offering is a mental health package, if you will. So it'll be 2 services, psychotherapy and case management. What the psychotherapy's aim is to get to the inner needs or the internal needs of the refugee. So it's very common and very normal for individuals who've survived terrible war atrocities to have lots of sadness, lots of fear, and lots of anxiety. So that will address that piece. The case management piece will address the outer needs. So like the social connection, work, school, community involvement. Because we know, for example, depression impacts a person's ability to participate in meaningful or important activities. So our case managers are going to be looking through that lens and helping folks through that together. And then those 2 services are going to be in close communication. And then, like Dr. Letts said, in close communication with the doctors. So it will be like an interdisciplinary team, again, all under one roof, one-stop shop.
Wow, you had mentioned before we went on the air that this has been in the works now for about a year, trying to get this awesome collaboration.
Yes.
What were some of the things trying to get that all worked out, the barriers that you had to overcome to try to work that?
I mean, I think it's unique for a health system to be flexible enough and engaged enough in things like refugee health to allow for the sort of bureaucratic things that need to shift and flex to allow for a partnership like this between a primary care clinic and a internationally recognized organization like CVT. So a lot of credit to Health East for helping us make that happen. But I don't know.
Yeah, I mean, I think we're just about to launch. We're going to launch next week, and I think we're pretty aware that we're going to pay attention to what it means when 2 organizations come together. One of the things that struck me, we came and did a presentation the other week, and we asked the staff to turn their chairs around, and I turned around for a second. Everyone had already turned around. I thought, man, folks are really used to, in healthcare, doing things really quickly, and my background is as a therapist, where we may have had to have a discussion for 5 to 10 minutes about how are we going to turn our chairs around. So it's just those little cultural adaptations of 2 organizations coming together.
Well, that's amazing that you've been able to do that.
Yeah.
And I think you had mentioned too that even some of your own staff were refugees originally?
Yeah, one of the key things, in fact, probably the key thing that we've done over the last few years is we've hired staff who are refugees from Burma. So my nurse is a refugee from Burma. We have 2 full-time in-house interpreters that are refugees from Burma. We have a front desk person who's a refugee from Burma, and we have a care guide, someone who helps patients navigate the health system who's a refugee from Burma. So those, if you can imagine those families coming right off the plane and coming into a clinic in this scary new environment in this Western healthcare, what does it mean?
Oh, I can't imagine.
The comfort of seeing someone that looks like you and hearing them speak your language, you can just see the weight lifted off their shoulders. So that piece about having the staff is just huge, and it's going to be a huge piece of our success. I think too, one of the first staff members we hired for this project is actually a Korean refugee herself.
Wow.
So
So what would be the measure of success for this?
Yeah, we're actually going to be studying this intervention quite closely because we want to find out a few things. One, do people get better? And so we'll be asking participants throughout this period, we'll be doing measures that look at depression and PTSD and anxiety and see if folks actually improve. We also want to see if over time, does this cut down on healthcare costs? Will people go to the emergency room less or urgent care less for somatic complaints because they're getting their mental health needs
I didn't even think
addressed?
about that,
Yeah, and the other thing we want to find out is this something that is replicable? You know, if this goes well at Roselawn and Roselawn wants us to stay, we'd love to be there for the long term. But are there other clinics perhaps in Twin Cities or outstate Minnesota that may have less resources when it comes to mental health for refugees? Might this be something we can replicate throughout the state?
And what about for the Healthiest Roselawn Clinic? What will be a measure of success for you?
I think just seeing our patients do better.
Yeah.
We know that when we do get lucky, so to speak, and get a patient that suffers with PTSD connected with the right primary care doctor and the right therapist, we can see those patients really start to pull out of that and thrive. And I think the measure of success for us will just be seeing more and more of our patients connect with the services they need and thrive in this new country that they're very excited to be here.
Yeah.
So, and the Karen are very resilient people. I love that about working with them. But there's these challenges that I think we have a responsibility to help them overcome.
Well, I think that's got to be gratifying for you as a physician, though, to see your patients overcome and do well.
It is. It's a lot of fun.
We have just a couple of minutes left. Final comments about this?
One thing just to add, one thing I've learned about the Karen community is that they've had a civil war for over 60 years now. And one of the questions we often ask our clients, who again, we've worked with folks from over 60 countries, one of the questions we've asked them at our St. Paul clinic when folks come in is, what did you do before torture? Or what did you enjoy before the war? And when we've asked that question to the Karen community, the answer has been, we've never known peace.
Wow.
We've never had a calm time. So, just to emphasize the physical and psychological effects of just being in survival mode for so many years is quite profound and not something that someone can just pull themselves out of. So we really hope that we'll be able to help folks get on this path of successful resettlement in the United States.
And Dr. Lutz?
It's been a community effort. I think this is a great example of a partnership, and like I said, we've had other partnerships over the years. So I just say, if you have interest, there's opportunity to help these people who are at a vulnerable state in their lives. And Karen Organization of Minnesota is an organization locally that helps refugees who are in the process of resettling. So I guess I just throw in that pitch at the end.
Awesome. Well, I can't thank you enough both for taking time out to be with us today. Really appreciate that.
Thank you for having us on.
Dr. Jim Lutz from the Healthiest Roselawn Clinic and Allie Beckman from the Centers for Victims of Torture. Thank you both for being with us.
Thanks.
Well, still ahead, is your husband or wife or even your parents having problems hearing you? How do you know when you yourself have developed hearing problems and need some help? All that and more when we come back. Thanks.
Thank you.
Thank you.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back to Inside Healthcare, and joining us now is Allison Coates. She's an audiologist from Health East. Thank you for being with us. Appreciate it.
Thanks for having me.
So how common is hearing loss? Well, why don't we start with that first of all?
Well, overall, about 36 million Americans suffer from some level of hearing loss, and about half of those people are under the age of 65.
Really? Half are under the age of 65?
What many people don't realize is that children are very much impacted by hearing loss. About 6 in every 1,000 babies born does have significant hearing loss at birth, and about 12% of kids from age 6 to 19 also have noise-induced hearing loss.
And that is something that they're born with, or is it because of they're using earplugs
That
for
is something
loud music and things like that?
That is something they acquire later as a result of being in noise.
What would be some of the other common causes of hearing loss?
Lots of different things. Besides exposure to noise, there can be trauma to the ear or the head, ear infections or other diseases that target the ears. Some medications can cause hearing loss,
Wow.
including some chemotherapy agents.
I've never heard
And then there's
that.
always genetic hearing loss.
So what if your loved one has some, if you've noticed that they're starting to have problems hearing you, how can you tell if they're experiencing hearing loss or yourself? I mean, what would be some of the common symptoms that you might see?
Some common behaviors of people with hearing loss might be having trouble hearing in noise, in backgrounds of noise, restaurants, parties, large family gatherings. You might find yourself asking for repetition frequently or bluffing your way through a conversation.
Just keep nodding and going, yes, whatever you say. What would be some other things what are some of the causes as well that you were saying besides the medication and things? What would be some other things that might cause hearing loss?
Just being in loud noise, medications, chemotherapy, trauma, diseases.
And what would be some of the treatments? And when should someone go seek some medical help and come see a specialist like yourself?
If you've experienced any of those kinds of things, or if you are finding yourself behaving in the ways I just described, those are some signals that maybe a hearing test might not be a bad idea.
What's involved with the hearing test?
When we do a diagnostic test, it's in a sound-treated room with a very controlled listening situation. So it's very quiet. We use various kinds of headphones to determine what part of the ear is involved. And then we always counsel people at the very end, let them know what type of hearing loss they have and how severe it is, and what some possible treatments or recommendations we might have.
And what would be some possible treatments if you do have some hearing loss?
Usually the results are based on the test results as well as a medical exam. So often ear, nose, and throat physicians are closely involved with us. Other treatment options might be surgery, medication, just changes in your habits or behaviors. Assistive listening devices or hearing aids are sometimes used, and you can have any combination of the above.
Mm-hmm. And that usually does help with the problem then after that?
It usually improves. You may not get rid of the hearing loss, but you can certainly improve your quality of life.
So can anyone just go to see a specialist like you, or do they have to be referred by their primary care?
Referrals are always a good idea, just to make sure that your insurance will cover it. But we like to encourage people to contact their insurance carrier to make sure that they have coverage prior to coming.
And I understand that May is
Better Speech and Hearing Month.
And that's to bring awareness to the issue. And it really can be isolating if someone's having a difficult problem hearing.
It really can be. Hearing loss may not be life-threatening, but it certainly impacts quality of life. Some studies have shown that people with untreated hearing loss are more likely to experience depression, anxiety. They have social issues. And there's even been some studies that suggest a greater likelihood of impaired memory function in older adults with untreated hearing loss.
So if someone wants to get more information or possibly even schedule an appointment, how can they go about doing that?
Well, you could always call our scheduler. Her number is 651-232-0707. There's also some websites that go into more detail about hearing ability as well as hearing loss. And those are turnittoTheLeft.com and howsyourhearing.org.
Oh, good ones.
Yeah.
And then I understand Health East is also, while the supply lasts, is giving out free earplugs to anyone that would stop at the Health East clinics at Woodbury, Maplewood, and Midway, I believe.
Yes.
So, well, thank you, Allison Coates, for being with us. It's been a pleasure, and appreciate you taking time out.
Thank you for having me.
Thank you so much. And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. Thanks, everyone.